Hi, this is Mark Costco in Jackson, Mississippi. I'm sharing an interesting case of a patient who had a cataract surgery using a Vivity lens, which she ended up not liking. This video that you're watching now, the voiceover I'm doing for patients who are interested. If you are a surgeon, I have another video which you can find on my channel where the narration is specific to surgeons. But this patient, I'm going to get back to just kind of talking to patients who might be watching and might be interested in this kind of surgery. This patient had cataract surgery by a previous surgeon on her one really functional eye. Her other eye has had very poor vision since childhood, and she didn't really like her result, and that happens sometimes. Many patients do great with a Vivity lens, but some don't. And she has also had what's known as a YAG laser capsulotomy touch-up laser. You might think of it as that. And that is what has made removing this lens much more challenging. We've got to be much more careful with our dissection to get the lens out of the eye. The human lens, I tell people to think of it like an M&M. There's an outer shell, there's chocolate inside the shell, and even a peanut inside that. And when you do cataract surgery, you're carving a circular opening in the shell and then sort of aspirating out the chocolate and the peanut, and you're leaving behind the shell. And that shell then holds your lens implant. Well, here's the thing. The shell is not really a shell. It's actually the consistency of saran wrap. And so it kind of shrinks down around the lens to hold it in place. And you can see here, there's kind of some membranes that are holding this lens in position. And we have to use different maneuvers and instruments, and in this case this is a little gel product that I'm injecting to kind of push the sort of saran wrap shell off the arm of this implant to free the implant, which we just did on that side. But because the patient has had the YAG laser capsulotomy touch-up layer, we're essentially missing the back of our shell. So once we get the saran wrap sort of teased off this lens, it can be hard to get the saran wrap to properly hold a replacement lens. We ultimately are successful in that, but it's just more challenging to exchange an implant if the patient has already had a YAG laser capsulotomy. So if you've had cataract surgery with a lens that you just don't like, my advice to you is come see me or come see someone who does lots of exchanges before you let anyone do a touch-up laser on you. That image there is just going back to show what it looked like before we took the lens out. It was just kind of scarred in position, and so we've been teasing the lens out here. This patient didn't like the Vivity lens because of a lot of reasons, but and many patients who don't like a Vivity lens will say different things, but essentially it comes down to quality of vision. A lot of patients just feel like the quality of their vision is just off. Either the contrast is poor, or they just feel like they see blur, or they were expecting to get more near vision and they didn't. Usually Vivity just gives people distance and intermediate vision. It's not really designed to give people great up close vision, but some patients will just feel like all of their vision is not great with this lens, and I think it comes down to the way the lens affects contrast. But at any rate, she didn't like the lens, and she wanted to get rid of it, and she was really hoping to be spectacle or glasses independent, at least at distance. And so because of that, we chose an RxSight Light Adjustable Lens, or LAL for short, as her replacement lens. And you'll see that lens in the video in a minute. But here we're going to cut her lens, her Vivity lens, the old lens, which we're removing because she's not happy with it. We're going to partially cut it. We're not going to remove it all the way. We're going to leave it hinged right there so that we'll remove it later in a sort of Pac-Man style. The forceps will kind of adhere to the lens, so you just use that cannula to free it up. But we're going to inject our new lens on top of our old lens. We'll widen our incision just a little bit for that. But leaving the initial lens, this is another view of what the lens looked like before we took it out. And this is a view of something called an MTF curve, which shows that essentially that a Vivity lens can give people significant contrast sensitivity issues, which will make some patients just really not like the quality of their vision with a Vivity lens. And this is some measurements showing how we selected the power of her replacement lens. But one thing that's neat about the replacement lens in this case, which you're seeing images of it right here, it's a RxSight Light Adjustable Lens. Post-operatively, we can actually change the power of the lens to largely eliminate the patient's glasses prescription or get the patient's glasses quote-unquote prescription to a place that is ideal for the patient and minimizes glasses for the activities for which the patient most wants to have glasses minimized. With this lens you can treat astigmatism easily up to 2 diopters. I've treated more, but I would say it reliably treats up to 2 diopters of astigmatism. But we're going to inject this lens initially on top of our old lens, and then we'll remove our old lens out from under the new lens. So it just takes a second to get the new lens to kind of unfold the way we want it. It comes out vertically at first, but we will orient it in a good position. That's a cannula that puts some gel inside the eye that helps us maneuver the lens and protect the cornea. The little arm of the new lens is a little bit caught in the bisection of the old lens, so we'll just free that up there, and we'll push the rest of the new lens into the eye. Again, the new lens is on top, the old lens is underneath it, and once we get the new lens roughly where we want it, we'll add some more of that protective gel, first on top of the new lens and then behind the new lens, and then we'll move forward with removing the problematic old lens. We'll grab it with the forceps and we're going to remove it in a sort of Pac-Man style so our incision is not too big. I will get a second pair of micro forceps to assist me here. Essentially what I'm doing here is I don't want that half to break off and fall into the eye. So this is just being kind of safe and cautious. With the light adjustable lens, you can, say for instance, if you're only doing it on a single eye, you can make the lens such that the patient has no glasses at distance and maybe they just wear reading glasses. and that at least will give the patient really great vision somewhere without glasses, versus with the Vivity, this particular patient felt like she didn't have great vision anywhere, any distance, even with glasses, which we tried we tried glasses first to try to be conservative. Another thing I'll say, this patient had some vitreous floaters in her vision. She also had a history of a retinal tear. And because she had had a YAG laser capsulotomy, it just made it such that I could tell that she was going to come out better if I had a retina specialist do a procedure called a vitrectomy before I did the surgery that you are watching here. And so we did that. We sent her to a fellowship-trained vitreoretinal surgeon to have a full vitrectomy removal, which is removing all of the vitreous gel that's inside an eye behind the lens. That removed all of her floaters, and it also made her much less likely to get additional retinal tears or detachments from all of these maneuvers we're doing here. So we're just kind of cleaning things up here. I know if you've never seen the inside of an eye, it can be hard to know what we're talking about, but essentially I just want people to know, if you're unhappy with your initial lens implant, we most of the time can get you a good replacement lens that will improve your vision and make you happier than where you were before. So hope is not lost. Come see us if you fall into the percent of patients who aren't happy with their initial lens. We can get you a new one. Even if somebody tells you it's been there too long, I've exchanged lenses that have been in the eye as much as 15 years. So we can a lot of times help you out and get you seeing better. This just shows the adjustments we did on the lens. This is a picture from the adjustment machine. This patient has done really well, and it was a real privilege and honor to get to help her. This is my family hiking in Utah. Thank you for watching.